According to the Anxiety and Depression Association of America, anxiety disorders affect 1 in 8 children. Research shows that untreated children with anxiety disorders are at a higher risk to perform poorly in school. What's even more shocking is that according to the National Institute of Mental Health, 25.1% of 13 to 18-year-olds show a lifetime prevalence of anxiety disorders. Dr. Hannah Rockman is a clinical psychologist from York Region Psychological Services, and she is here to help us understand why students experience anxiety and how we can help them improve their grades. Welcome, Dr. Rockman.
Hi.
So what is your role at York Region Psychological Services?
Well, I'm the founder of York Region Psychological Services, and we have approximately 15 therapists who work there doing assessments and counseling for adults and children. So my role is sometimes to do the assessments and the therapy, and sometimes I will just supervise one of the clinicians doing the work.
And what type of assessments and counseling do you have for young children?
For children, what we do primarily is learning disability assessments or gifted assessments. Sometimes we'll also do psychological assessments if they have some psychological issues, but primarily it's related to school, so it'll be more in the realm of learning disability assessments.
And looking at those statistics with the anxiety, I think they were staggering. Let's try to get a better idea. What exactly is anxiety?
Right. Well, that's true. Those statistics are worrying. And the truth of the matter is that if a child has anxiety or is highly anxious in grade 1, by grade 5, you'll find them in the lower third of the class. So if it's untreated and ignored, then often you'll find that they perform poorly, and you'll find that adults, for example, who've dropped out of school, and if research shows that if you ask them, about half of those will say that anxiety was a main factor of them leaving school. So it does lead to dropout, and it does lead to poor school performance. And so that's why it's important not to ignore your child if he's showing or she's showing signs of anxiety.
And what does anxiety look like in a child? How would we know? Because sometimes we look at children and we can maybe see nail biting or some shaking,
right,
or something physical. Is there something else
right,
that we would know when we're looking
right,
at a child if they're anxious?
Well, there are physical signs and there are mental signs of anxiety. And similar to adults, anxiety comes in several forms, but in children, often you'll find clinginess, crying, temper tantrums, school refusal, and often they'll be very worried about things that ordinarily a child wouldn't worry about. So, for example, they'll be very, very alert to any sign of danger. So if maybe the teacher will call a child in class and say, you know, Alan, come see me after school, a child who's very anxious will think, oh, I'm in trouble, right? But a child who isn't anxious will say, well, I really hope I don't miss my lunch break because of this. And so in children, you'll find similar symptoms to adults. For example, dryness of the throat, inability to swallow, a lot of stomach aches, headaches, crying, insomnia. And same as adults, they'll be irritable, they'll be moody. So the thing is that if your child is usually like that, they may have an anxiety disorder, but if you notice that it's just when school starts, then it might be related to school, it might be something in school, or it might be something to do with the home environment.
Quite often, you know, the parents hear the excuse their children say they have an upset stomach, and
right,
quite often parents would ask their child, okay, well, you know, what's going on at school? Is that usually an indication that there's something going on? You know, when we have butterflies in our stomach and that interferes with our performance. The same idea with kids?
Well, just think if you every year had to start a new job with new colleagues and possibly a new boss and maybe a new office space. So it is anxiety provoking. Now, for most children, they're a little bit nervous before going to school, and that's very normal. That's nothing to worry about. But if this persists and you see that your child isn't getting better and he starts to, or she starts to say, especially on days that they might be called upon in school, say if they have a presentation or an exam or an occasion where you know that they're going to be peer reviewed, those are the days they want to avoid school on a regular basis, then there may be an issue going on at school. And it's really, really important not to let them avoid school.
So besides some of those physical signs of having the stomach ache or maybe the irritability, are there any other signs that a parent would see in a child that would indicate that my child has an anxiety disorder or has some sort of anxiety issues?
Well, psychologically they would be more withdrawn. they'd be maybe crying a lot more. They'd be super alert to things like danger. They may have nightmares. They may feel that they have no friends. They feel very anxious. You can see in their body language often. They'll be more sort of enclosed in themselves and try not to draw any attention to themselves.
And so a parent would probably say, okay, well, he's not being himself or she's not being himself.
Exactly.
So they would notice a change in the behavior. Would this change come on gradually, or would this change be more sudden and a little more spontaneous, would you say?
Well, if it's related to school, then you'll see it coming on as school approaches, right? And so you'll see that they start to worry about school and they want to maybe ask you reassurance all the time. So a child who frequently says, well, when am I going to school? Or how long is school going to be? Or when can I come home for lunch? And they keep asking the same question, even though you've reassured them several times. You know that it's related to school. And often it will come on, not exactly suddenly, but it'll certainly come on towards the beginning of school. Whereas if it's a general anxiety disorder, you'll see that this is the same at home and at school. So it's not related, it's just that their personality. And often children who are perfectionists, they're much more anxious, and so they cannot tolerate making mistakes. They freak out when anybody touches their stuff or their school books, or if they feel that their homework isn't perfect, then they will procrastinate. So you'll find a child who has a project and leaves it to the last minute, not because they're lazy and not because they don't know what to do, but because they feel it's not going to be perfect, and they cannot present it if it's not perfect.
And you know, I've dealt with many children who have had that sort of perfectionism, and I think it's really important to show kids that it's okay to make mistakes.
Absolutely.
That's part of life. We do that as adults, some more than others.
Exactly.
But it's a very important life lesson to teach them that that's okay.
That's right.
Where does this anxiety come from, do you think? Where's some of the origins of this anxiety? Is it parenting? Is it learned behavior? What would you say?
Well, I think it's really important for parents not to blame themselves, because children, first of all, are born with a certain temperament. And that's the first thing that happens when a child is born. They have temperament. Some children are extroverts, some are introverts, some are perfectionists, some are laid back. And you as a parent will interact with them depending on your personality, which is something you can't control either, right? So if you're a very laid-back parent who has a very, very perfectionist child, you'll think you will find it fairly difficult to understand them, and you have to be really careful not to punish them for these kind of behaviors, because it's not something they're doing on purpose. They're not doing it to punish you in any way. So you really need to be supportive. So one of the issues is temperament. The other issue is genetics. Anxiety is highly genetic. You're more likely to have a child who is anxious, whether it's genetic or whether it's modeled behavior. If you're very anxious before they go to school of anxiety, but then on top of that, there are temporary sources of anxiety. For example, the beginning of school, or if there's a death in the family or change in the family, say a new marriage in the family or a new baby in the family, or sometimes just some disaster that they hear on the news, which makes them very anxious, especially if it's talked about a lot in the news and you allow them to watch it a lot on the news.
So then it's important. Parents should kind of take a look at themselves and say, okay, this is where I'm at. Perhaps this is why my child is the way he or she is, and see the bigger picture rather than just putting the onus on the child and saying, okay, you're anxious or you're having these issues. So most parents could take away this idea that perhaps this is something that is related and it's in the family, and they need to take a step back outside and say, okay, how do we get this? How do we deal with this? How can we show our child to be less anxious, and how can we ourselves be less anxious?
Exactly, because if you model to the child that you can deal with your anxiety, and also that you know they can deal with their anxiety. If you don't get to a situation where you try to get them to avoid anxiety, for example, by taking them out of school, or every time there's a situation where they might be anxious, you find a way for them to escape the anxiety.
Thank you. We'll hold that thought. Thank you. That's great. We'll be right back after this. Please stay with us.
This program is brought to you in part by Bialik Hebrew Day School and the exciting opening of our second branch.